Hey, good morning everyone. Welcome to my YouTube channel. So in this video, we have just discussed about the vital sign. So let's start the video. So today we discuss the vital sign. Vital sign is a very important chapter, right? So before going any clinical duty, we just learn about the vital sign. So we start the vital sign. So vital sign are defined as the sign of basic physiology that include temperature, pulse, respiration, and blood pressure. If any abnormality occur in the body, vital sign change immediately, right? So purpose to detect any change in normal body function or to determine respond to treatment, right? So first vital sign, that is temperature, we discuss. Okay, so temperature is a hotness or coldness of the body, right? So body temperature is the balance between heat produced in the tissue and lost to the environment, right? So in our body are lots various type of metabolic reaction occur that can produce heat, okay, or heat lost by the environment, right? The hypothalamus is a section of brain responsible for control of body temperature. The normal range of body temperature is between 97.5 to 99.5 degree Fahrenheit, okay. And then women maintain a consistent internal body temperature. Heat is produced during body metabolic process and lost through four process like radiation, conduction, convection, and evaporation. Okay, and then we discuss the alteration in body temperature like pyrexia. Pyrexia, also known as fever, means increase the body temperature, which can divide into three form: high grade, moderate, and low grade, right? Hyperpyrexia, if temperature increased more than 40 degrees Celsius, then it is dangerous for functioning of the human body. In this time, body's function not working proper. Okay, so might be lots of complication are there. Okay, so hyperpyrexia, if temperature hyper and hypo. Hyper means increase, hypo means decrease. So hypopyrexia means temperature is below than 30 degrees Celsius. If temperature is below than 34 degrees Celsius, means it is a very severe hypothermia case, and this case leads to death. Okay, and then continue factor affecting temperature like environment, cold season, summer season, like that, time of the morning time, mid time, okay, exercise, stress, okay, hormone, drugs, and presence of illness are the factor that affect the temperature, right? And then we discuss the site for assessing temperature, okay. And first, that is orally we can assess the temperature. How you can assess the temperature orally, we just continue in next slide. I put a image, then you can understand better, okay. So axillary and rectal and tympanic, so discuss, okay. Orally, we place thermometer below the tongue and measure temperature. For axillary, we place the thermometer just inside the armpit, okay. And in rectal, you as see in the picture, and in tympanic membrane, this kind of thermometer is very different. So we put just ear canal and measure the temperature, right? So one MCQ is basically formed from here कि most common uses site for measuring temperature, then you call axillary, or most accurate reading of temperature, then we say rectal site, okay. And then we study equipment like thermometer is a device that measure temperature, right? So these are four types basically: electronic thermometer, glass thermometer, paper thermometer, and tympanic membrane thermometer, right? So let's just image, okay. Electronic thermometer looks like that, glass thermometer and paper thermometer put on the forehead, and on the basis of color we decide the temperature of the body, okay. And then tympanic membrane thermometer, okay. And then we continue with next vital sign, that is pulse rate. Pulse is a pressure of blood pushing against the wall of artery as a heartbeat and rest, right? The normal pulse rate is 60 to 100 beats per minute, right? Then we discuss tachycardia and bradycardia. Tachy means increase, brady means decrease. So tachycardia means rapid pulse rate greater than 100 beats per minute. Or bradycardia is a pulse rate below than 60 beats per minute. Right. So factor affecting pulse: pain, fever, stress, exercise, bleeding, decrease in blood pressure, and some medication. Okay. And then we discuss the site of taking pulse rate, like first temporal, carotid, apical, brachial, radial, femoral, popliteal, posterior tibial, and dorsalis pedis. In this, we just remember most common measuring site for pulse rate. This that is radial. Okay, radial is a most common measuring site for pulse rate. Okay, and then we continue with major arterial or pulse site of the body, like temporal side of the forehead, carotid side of the neck, brachial inner aspect of forearm at the antecubital space, radial inner aspect of wrist above thumb. Okay, and then you just read out. Okay, you see in the image, I think you all are understand. Okay, and then we continue equipment, how you can measure the pulse rate, right? So pulse rate commonly assessed by palpation or auscultation, right? So what is pulse rate? Pulse rate means the number of beats per minute, right? So yeah, this is a pulse rate. This is pulse oximeter. With the help of we measure the pulse rate, right? And then we discuss the rhythm. Rhythm means pattern of beats or spacing of the beat, right? It can be regular or irregular. Okay, if rhythm is irregular or abnormal rhythm of the pulse, that is called arrhythmia. Okay, it is occur by any defect in the electrical conduction pattern of the heart. I hope you know about the conduction pattern of the heart, right? Like which things can produce the electric impulse, like SA node, AB node, Purkinje fiber, bundle of his, like that. Okay, and then we continue with the next. This is normal things, you just read out. Then in which condition pulse rate will be decreased, like sleep, depressed drugs, heart disease, and coma patient. And increased like exercise, stimulant drugs, excitement, fever, shock, anxiety. Okay, now we discuss the respiration. Respiration is the process of taking in oxygen and expelling out carbon dioxide from the lungs and the respiratory tract, right? So when assessing respiration, you measure the breathing of the pattern or patient. Okay, so one respiration consists of one inspiration and one expiration. Okay, and then inspiration and expiration is automatic or controlled by the medulla oblongata. Okay, factor affecting age, activity level, position, drugs, sex, illness, emotion, and temperature. Character and rate of respiration. Okay, so respiratory rate is the number of breathing cycle per minute, right? So normal value 12 to 20 for children, 16 to 25 for infant, 30 to 50. Please comment your answer why in case of infant respiratory rate is increased. Okay, so basic term we have to discuss, like eupnea means normal rate or the depth of breathing. Tachypnea means rapid. Tachy I already said. Tachy means increase, right? So tachypnea means rapid respiratory rate above than 25, or brady means decrease. So bradypnea means low respiratory rate usually below than 10. Okay, apnea means absence of respiration. And then we discuss next vital sign, that is blood pressure. So blood pressure, measurement of the pressure that the blood exert on the wall of the artery as the heart contract or relax, right? Measured in millimeter of mercury means of Hg. So blood pressure measured by the instrument that is sphygmomanometer. Measured a read in a 2-point systolic and diastolic. So systolic pressure is the force exerted against the arterial wall at as left ventricle contract pumps blood into the aorta. So maximum pressure exerted on vessel wall, right? So diastolic pressure is arterial pressure during ventricular relaxation when the heart is filling, right? And blood pressure is recorded as a fraction, systolic on top, diastolic on bottom. So yeah, if any patient having blood pressure value is 120 by 80, means 120 is a systolic pressure and 80 is a diastolic pressure, right? And normal range of systolic pressure in between 100 to 140, okay, and for diastolic it is 60 to 90 but not less than 60, keep in your mind, okay. And some alteration in blood pressure, if blood pressure is high then you called hypertension. Hypertension is also divided into different type, like type 1 hypertension, type 2 hypertension, like that, okay. So if blood pressure is low then we called hypotension. Hypo means decrease, right? So yeah, indicated when pressure are less than 100 mmHg systolic. For diastolic less than 60 then you called hypotension, okay. Factor influencing blood pressure: force of heartbeat, resistance of the arterial system, elasticity of the artery, volume of blood in the artery. Factor may increase blood pressure like excitement, anxiety, nervous tension, exercise, eating, or decrease like rest, sleep, depression, drugs, shock, excessive blood loss. Okay. So what is SpO2? SpO2 is also known as blood oxygen saturation, measure of amount of oxygen carrying hemoglobin in the blood related to the amount of hemoglobin not carry oxygen. Right. So by the help of measuring SpO2 we can identify कि in the human body right amount of oxygen will be giving out or not, okay. So because of a lack of oxygen might be cyanosis and organ dysfunction will be occur, right? So this is a very important vital sign, okay. How you can measure, you just learn in clinical duty, okay. This is only a written form, you just read, okay. And I will discuss just normal SpO2 level, okay. This is a pulse oximeter, okay. So blood oxygen saturation we have to discuss. If SpO2 level is less than or equal to 90%, then it is some complication might be there, so we consider consulting your doctors. If your SpO2 level is 91 to 94, then it is an average, it's okay. Okay, so if your SpO2 level is 95 to 100, then it is very good, and it means your RBC are well oxygenated and sufficiently transporting oxygen around the body, right? And symptom of hypoxemia means if in your body not getting right amount of oxygen, then you can suffering from hypoxemia. Hypo means less, mia means blood. If oxygen is less in the blood, then you called hypoxemia, right? If hypoxia means less oxygen in the tissue, hypoxemia means less oxygen in the blood, okay. And then this is the condition when your body not getting right amount of oxygen, then we suffering from cyanosis, means bluish discoloration of the body, right? So I hope you understand my video. If uh, if thanks for watching my video, and please subscribe my YouTube channel. Thank you, have a nice day.